So, what are some tips you could give us on like recovery? Like, what things do you feel that is most important, or that you feel that we should know?
So, specifically for people, I'm going to narrow it down because I think this is something that may not always get communicated to people. Sometimes the common knowledge has been around 6 months or a year after a stroke, however you're doing is how you can expect to be, and that's your new normal. But that can be really misleading, and I don't want any stroke survivor to think that that's how they're stuck. The rate of progress does slow down a little bit, but you can continue to improve like 15, 20 years after a stroke. We've seen that too. Neuroplasticity is active, and you do have to activate your neurons and tell them how to reconnect, because some have died in the stroke, and the ones that remain need to learn new functions and form new connections. So there are great things like Feldenkrais, which is a somatic therapy class that really accesses this component of our mind where we hold ourselves back. A lot of the times, our own beliefs will hold us back from trying something. If you have a stroke and your right arm isn't working, in my assessment at the bedside, as you all have probably experienced a million times, I would say, hold out both your arms and let's see if you can hold them up off the bed or off the chair. And one of them is weaker, maybe you can't even move it. And I'd have a lot of patients say, it's not going to do anything. Well, that's your brain telling it it's not going to do anything. So you have to look at your arm, tell your arm to move, and their physical therapist can really help with things like this, but you have to open your mind to improving, and you may not see an improvement for a while, but it's really important for you to realize that the messages you're telling yourself in your mind, especially the words you say out of your mouth, are sending messages to the parts of you that you're trying to heal. And so you have to be very intentional with your self messaging as you're recovering, and that is the biggest limiting factor.